Hello everybody, Captain Klein here. Welcome to week 4 of Q&A with the Captain, where we cover topics of interest to our sailors and civilian personnel. This week's topic is all of the services available to you and your family during the COVID-19 pandemic. At the end of this video and on our Facebook page is a flyer with some important phone numbers, web addresses, and other information that you'll find useful. I encourage you, after watching this video, to go and download a copy so that you have it for reference. Question number 1. What services are available to military families during this time? As we adapt to the distributed work environment due to COVID-19, our Fleet and Family Support Center has transitioned their services to telephonic and virtual platforms to ensure they can continue to provide the widest range of support possible. Even though they're not currently seeing personnel in person, they still can assist with things like counseling and suicide prevention, domestic violence intervention, financial counseling and budgeting, new parent support, transition and employment services, exceptional family member program, and sexual assault and response, the topic of our video last week. So we have 3 centers that you can reach out to, and there's many more throughout the Hampton Roads area. The Portsmouth Annex Center, which is our primary office, the phone number is 757-953-7801. Northwest Annex has a center, reached at 757-421-8770. And though they technically work for Naval Station Norfolk, the Fleet and Family on Hampton Boulevard can be reached at 757-444-2102. Question number 2. Financially, I don't know how I'm going to pay our bills and get through this pandemic. I'm not working right now. My husband is in E3. What financial services can you provide? There are financial resources and assistance available for military members, their families, as well as civilians. The Navy Marine Corps Relief Society can assist and answer any questions you may have about extra financial help that's available. They can be reached locally at 757-322-3134 or 1171. They also work with the American Red Cross after hours if you're in a financial emergency. For our civilian personnel, the Department of the Navy Civilian Employee Assistance Program has resources available for financial counseling and credit counseling and can help you out if you get into a financial bind. I encourage you, if you encounter any of these problems, to engage with your chain of command and let us help you figure out what resources are available. Question number 3. I'm feeling anxious, scared, and uncertain about what's going to happen to me and my family with regard to COVID-19. What resources do you have that can help me during this time? This is a very challenging time for everyone, so I completely understand your concerns and your fears. We do have various ways that we can help you and your family, but primarily I would point you to our Fleet and Family Support Program. The Mid-Atlantic region has set up a call center that can distribute your service requests throughout the region to find you the most appropriate provider. They are available from 7:30 to 4 p.m. every day, Monday through Friday, at 1-800-FSC-LINE, that's 372-5463. We also have our Mid-Atlantic Chaplain line available 24/7 at 438-3822. And our own command chaplain, Chaplain Moynihan, is available at 421-8205. In addition, as I mentioned earlier, our own personal Fleet and Family Support Centers at Portsmouth Annex and Northwest Annex are available and have multiple services that can help you out as well. Question number 4. If someone at the command tests positive for COVID-19, what do you do for that person and their family during their time in isolation? Well, this is a really complicated question actually, because our actions to support our sailors start well before someone tests positive for COVID-19. I want you to know that every member of this command, military or civilian, will be provided with the support they need while they're impacted by COVID-19. But it's going to be very challenging. No matter how often someone calls to check in on you, that quarantine, that isolation period, is mentally and emotionally stressful for you and for your family. So how we look at doing this, for starters, is everybody should be keeping track of their daily movement and the people they come in close contact with. This is going to be very important if you do develop symptoms of COVID-19, because one of the most important things we can do to limit the spread of the disease is to quickly contact those folks who you've come into contact with, who may need to go into quarantine themselves to try to keep them from also developing symptoms, or if they do develop symptoms, to have them quarantined already so that they don't infect other people. So if you do experience symptoms of flu-like illness, you're going to immediately be told to self-isolate, and that helps to limit the spread of infection to others. Your chain of command will engage with you so that you can make sure you've contacted a medical provider, you have a place to stay that meets CDC guidelines for isolation, which is currently a room with a private bed and a private bath. So if we have a sailor who lives in a shared barracks room, or anyone, military or civilian, that can't isolate themselves at home, the command will put them on TAD orders and get you a room at the Navy Gateway Inn and Suites or the Navy Lodge here locally to support you during your isolation period. Chain of Command will also ask for that movement and contact history report so that we can go ahead and notify those other folks who were in contact with you, and they can also be placed in quarantine. We've also developed checklists that the Chain of Command will use, and what they'll do with those is they'll develop a daily plan of who's going to be in touch with you and what sort of health and comfort support you need, such as food or toiletries, and any medical following and medical appointments that you have to get to. Your Chain of Command will help you during your time in isolation. So as far as the testing goes, there still are some limitations on the availability of testing here in the local area. And so as you contact your health care provider, they're going to be the ones who determine whether a COVID test is actually done. So once that test is directed, or they tell you to go to a medical provider for follow-up, your Chain of Command will support getting you there and make sure that you can get to and from your medical appointments. So if it comes back as a positive, or the healthcare provider diagnoses you just based on the symptoms, you'll stay in isolation until the symptoms subside, and the Bureau of Medicine has published a return to work guidance that dictates when you can come back to the workplace based on your symptoms and how long you've been infected. So as mentioned, Fleet and Family also has an incredible array of services to support our patients and families and everyone in quarantine or isolation. So when you go into isolation, you'll be given a list of that contact information, and during your daily contact with your Chain of Command, they'll be checking in on you and encouraging you to reach out for support that you may need. So I encourage everybody to do what they can now, before they get sick, to be prepared, because with the progression of this disease and with the disease vectors that are out there, I think it's more than likely that a lot of us are going to be affected personally. And so the steps that you take now to prepare, just like as if you were going on deployment, are going to help you when it happens to you or when it happens to someone you love. If you haven't done it yet, I recommend everybody get with their department head or their supervisor, get a copy of our checklist that we've developed for preparing for isolation or quarantine, take it home and discuss it with your family, and have your plan. Question number 5. How do I get help for someone I know or care about who is in an abusive relationship and it has gotten worse as a result of COVID-19? Well, the COVID-19 pandemic has been very difficult for many families, going through the losses of jobs, struggling financially to pay bills, uncertainty about the future. You got your kids home from school unexpectedly. You've become a teacher when you never dreamed of being a teacher. The issues and feelings can really put a strain on even the best family relationships, even the strongest relationships. And unfortunately, that can lead to abuse. So if you find yourself in a situation where you or someone you know is being abused, once again, I'm going to encourage you to reach out to our Fleet and Family Support Center for help. We do have a Family Advocacy Program Victim Advocate. Her name is Jessica Zimmer, a wonderful person, and she can support you during this time and put you in touch with the resources that you may need. So she can be reached at by phone at 953-7801 or 901-930-8661. There are also many online groups, telephone hotline numbers that you can call, and they're created specifically to help deal with victims of abuse or with the fear of abuse. Please, don't be afraid to reach out to the experts. Don't be afraid to reach out for help during this time. There are a lot of people out there you can trust. There are a lot of people out there who are standing by to help you. Your shipmates, professionals, your neighbors, your family. We all want to get through this safely. We all want to support each other through this. The unprecedented situation we're in with this pandemic really has changed the dynamics of how we interact with each other. So don't wait until it's too late to take action to support yourself, support your family, or support your friends. So that's all for this week's video. Until next time, wash your hands, wear your mask, and please everybody stay safe. Captain out.